Okay, guys, this is Cassie Westmoreland. We are going to go ahead and jump into our ESG CV and ESG 20 NOFA overview. We do have just a few housekeeping things for you guys to be aware of. So we are recording this webinar for folks on your teams who can't attend. We will be posting this on the DOH ESG page. Please, on the chat function, if you guys can look and make sure that you are chatting not just to all panelists, but to all panelists and attendees. Kelly Fossbauer and Chelsea Mandel are our two new ESG staff folks, and they are going to be helping us manage the chat as we move through this webinar. So please feel free to put comments, questions in there as we go through, and they will help kind of tag things as we go along. But make sure that it says to all panelists and attendees, because otherwise it won't get seen until I stop sharing my screen. So if that happens, I do apologize. But yeah, let's go ahead and get going. And Kelly or Chelsea, if you wouldn't mind putting the link to the notice, to the ESG CV notice in the chat, I'll probably have you guys do it again, but just so that folks can start to look at that. So just a kind of overview of what we're going to be covering today. I want to clarify some timelines and next steps, especially for folks who are receiving CV1 funds. I know there's some questions about contract timing with that. We're going to dig into the ESG 20 renewals and new applications. That's going to look very different this year, especially for folks who are very familiar with the regular ESG process. We're going to really dig into the ESG CV2. There are some new eligible activities and some pretty significant differences from regular ESG funding that we want to make sure folks are aware of. And that's in the notice that hopefully was just posted in the chat. There are some documentation, reporting mechanisms, and other, fun bureaucratic things that will be for both ESG and ESG CV. So we're going to make sure to go over that with you all. And then we've got some pretty exciting resources and webinars coming up that we want to make sure that folks are aware of. So hopefully we will get through all of this quickly, and we'll have some time for questions at the end. I know you all are getting a bombardment of notices from us and from HUD and from other funders. It seems like things are changing by the minute. So as of today, which is October 2nd, I think, this is what we know today. There are some points in the webinar where I'll point out, like, we know that HUD is going to give us some new information, or we're waiting on some further guidance for these very specific questions. So as it stands today, this is what we know, but please know that things might change. It's a very fluid situation, which I know makes planning very hard, but we are going to try and be as flexible as possible. And that's part of the reason why we're doing lots of webinars, as you'll see. So jumping in, we are going to just talk about timelines and next steps. So this NOFA for ESG CV20, which is the regular ESG program, and the ESG CV2, which is the second allocation of the CV funds, CV being coming from the CARES Act, the $4 billion or so that was allocated across the country through the CARES Act, specifically to ESG activities in response to coronavirus, COVID-19. We released the NOFA on September 23rd. Letters of intent are due October 8th, and we're not going to ask, we're not going to invite people to apply or anything like that. We're just kind of trying to get a sense of how many folks do want to apply and what folks are going to be applying for, to give us an expectation of how much time we'll need to review the NOFAs, quite frankly. So please feel free. In the NOFA, there's an outline of what the letter of intent needs to entail. So please do let me know if you have questions or concerns about that. And know that the LOI is not binding, right? So if you submit an LOI and something happens on October 9th and you need to change your LOI, that is fine. We're, again, just trying to get an idea of who's out there, who's coming in, and what they're going to be needing. And then those applications are due October 23rd by 5 p.m. Mountain Standard Time. And we'll go over some of the documentation and eligibility and requirements and all that sort of stuff. But all of those documents will come to me. I will give you guys my contact information at the end of the webinar. It's also in the NOFA itself. But if you have any questions around how to submit or what you need to submit, always feel free to reach out. There are a few timelines that we want to make you aware of. So for the ESG 20 grant, we are going to be sticking to the same timeline that we have seen for our other ESG regular grants, which is April 1st through March 31st of the following year. So for the timeline for those grant agreements, we're going to April 1st of next year through March 31st of 2022. For the CV1 timeline, so those are the funds, the $7 million that we allocated earlier this year. For folks who have received that, I know you still don't have your contracts, and we're working on those very, very quickly. I'm hoping that you'll see them within a week. If you don't, please let me know. But the timeline for those does allow for pre-agreement costs back to March 27th, 2020. Those contracts will expire at the same time as the current ESG contract, so March 31st, 2021. And that's really for that initial first push of dealing with COVID, helping to do some of that crisis management that communities had to do. For the CV2 funds, we have $25.3 million in CV2. We allocated just over $2 million of that to expand the Next Step program, which is a prevention program for school-aged kids and their families. We are separating the remaining ESG CV2 funds into two NOFA applications, processes, whatever you want to call it. This is the first of that process. And that timeline is going to look like October, in terms of the grant, when you can spend funds, around October of this year to September of next year. And you guys are probably saying, it's October now. We are going to have pre-agreement costs in those contracts as well. We want to make sure that you all are able to get money into your communities for the upcoming winter season. We know that there is a lack of beds. We know that there is, additional requirements with social distancing and some of those sorts of things that has limited our winter shelter. So we're putting out up to $12 million in this first ESG CV2 NOFA process to help with that winter capacity. So while you won't see contracts for these funds likely until December of this year, please start planning and start knowing that if you're awarded, we will notify you hopefully as soon into November as humanly possible, but we will likely allow for expenses around sometime October. We'll get that specific timeline for you all when we do our award letter process, so you will have a clear understanding of what that timeline looks like. And that first allocation will go through September of 2022. And then the next NOFA that we're going to put out is going to be, oh, and I just realized a typo. So it's October of 2020 to September of 2021, not October of 2021 to September of 2022. So that's this October to next September. Not next October to the following September, just a heads up on that. Sorry, guys. And then the next ESG NOFA will be released this December. The reason that we're separating those two out is because with our second NOFA, we're really looking at expanding our subrecipient pool and making sure that we have an equitable and diverse group of subrecipients, and that we're using these funds to strategically partner with agencies that we might not have partnered with in the past or who might not have traditionally used ESG. We want to make sure that these funds are invested in a way that helps us have a better homeless response system across the state when this crisis is over. Just a few things to make note of. In the CV notice, which is the ESG guides for the money that's coming from the CARES Act, there are a few deadlines that are not the September 30th, 2022 deadline that we have been talking about. So one of those is emergency and temporary shelter. So if you all are planning on doing emergency and temporary shelter with any of the CV funds, please know that those funds have to be spent down by January 31st of 2022. There's no flexibility around that, unfortunately. That's what the notice says, and that's what we have to do. So our contracts will reflect that, but for folks who are shelter providers, please know that's the timeline that we are looking at. Okay, I think that's all I have for this slide. It looks like there are a few questions in the chat. Kelly and Chelsea, is there anything we need to respond to, or are we good to go to the next slide?
Yeah, Cassie, could you just give a brief overview of, so one question that came in was, will the grant agreement timeline for the second ESG CV2 NOFA differ from the current ESG CV2 timeline? I was wondering if you could just, give a brief overview of that.
Yeah, that's a great question. Full transparency, we haven't gotten that far yet. I think probably not. I think what we're going to really focus on is getting all of the winter shelter and emergency shelter activities out in this round. We, as the state of Colorado, are in the process of receiving some targeted technical assistance from HUD as to how we can expand that subrecipient pool. And so we're going to make a lot of our decisions about that second NOFA process based on the TA that we get. So they're helping us to draft a data map to find where the gaps in services are. That includes, regional and demographic trends as well as service trends. So if that map says, hey, you're completely missing shelter in these parts of the state, or you're completely missing rapid rehousing in these parts of the state, that really will dictate the activities that we fund, which will also dictate our timeline based on some of those internal CV notice deadlines. So full transparency, we have not gotten that far yet, but we will let you all know as soon as we have an idea. Likely before the December NOFA, we'll put out some sort of notice, but by that time that we put out the NOFA, we'll have a very clear expectation in that NOFA as to what that timeline will look like. Any other questions before we move on?
That's it. Thanks, Cassie.
Great. Okay, so application documents. So like I said, all applications require a letter of intent. Regardless of what you're funding for, we're going to want just to see a letter coming through. Again, submitted to me by October 8th, that's a Thursday, by 5 p.m. Mountain Standard Time. If you can have it on a letterhead, and we just want to know the name of the applicant, what you're applying for, the estimate of what you're applying for, and again, that can change between LOI and application if something comes up. The components, so if you have an idea, we're going to do shelter, we're going to do, outreach, whatever that looks like for you. And then if you're applying for the CV funds, we need to know how these funds will help you prevent, prepare for, and respond to coronavirus. That is the kind of underlying purpose for the CV funding. And we'll get into more of what that looks like, what those words mean for HUD and for DOH later in the presentation. Just another reminder on the LOIs, we're not going to be doing like an official invitation to apply or anything like that. I will respond to the letter of intent, just notifying you that we've gotten it, that we accept it. If I have any questions, we'll let you know, but that will be the only official notification you get for the letter of intent. For the ESG 20 applications, again, that's the regular ESG that we get every year through DOH. The renewals will only have a 2-page renewal form. You can find that renewal form on page 19 of the NOFA, and it's pretty straightforward. We are prioritizing renewals this year over new applications just for the sake of consistency in those projects. But if you are wanting to do a new application, you absolutely can apply, and you would just need to submit the full application. There's a project narrative, a project budget, and all the supporting documentation that goes along with that application. And all of that is in the NOFA page. You can see the pages there. And then the project budgets are actually going to be online at the DOH page. Kelly or Chelsea, if one of you guys wouldn't mind popping that into the chat just so folks could access it, that would be great. And then for CV2 applications, it's very similar to the new ESG applications. It's going to be a project narrative. It is a different project narrative than the ESG, the regular ESG, so make sure you're distinguishing between those two. A project budget, again, very different from the ESG because there are different eligible activities. And then all of the supporting documentation. The supporting documentation is the same. That will be for any application that you're doing, that those 10 or so documents need to be the same. Any questions so far, guys? Great. I'm going to take silence as no news is good news, but let me know if I'm misinterpreting that. Okay, so getting into the ESG 20, the regular funds. Again, we are prioritizing those who have existing ESG 19 contracts for the ESG 20 funds. These slides will, the funding for these either renewals or new applicants will be the same. And you can we're going to go through some of those eligibility requirements now. But just want to be very transparent that we're prioritizing the folks who have existing contracts so as to have consistency and contingency in those projects. So You'll see there that it says eligible applicants, and this is ESSO. That means emergency shelter and street outreach applicants. So if you're applying for one of those two components, you have to have a 501c3 designation or be a unit of local government. HPRR, which is homeless prevention and rapid rehousing, you have to be designated as the continuum of care lead. There are different eligible applicants based on what you are applying for. The 19 funds, the application that we put out last year, had that split, and so the 20 funds will also have that split. You'll notice that's different from the CV2. So please let us know if that's very confusing. We realize that, so please ask questions and let us know what's confusing, and we're happy to walk you through that. A few things to note about the ESG program requirements, regardless of if you're a renewal or a new applicant. There is at least 50% match required for ESG funding. You can do up to 100% match like it was last year, but you do have to provide at minimum a 50% match. And the match, just a quick clarification, we do have guidance out around what match can and cannot be. Quick overview of that: if ESG can pay for it, then it can be used as match. But if ESG cannot pay for it, and by ESG I mean your individual agency's contract with us for ESG, if you cannot do that in that contract, then you cannot use funds spent on that activity for match. So the really easy example, if you are a shelter provider and you are also providing rapid rehousing, unfortunately, you cannot use money spent on rapid rehousing to provide match for your shelter component. That being said, if you are a shelter provider and you're also doing street outreach, then you can provide the match from the street outreach for your emergency shelter. We have quite a lot of documentation out on our website, but we are happy to walk through those questions with you. Match has been something that's kind of confusing for folks, so let us know what questions you have. And match can be in kind, it can be cash match, it can be volunteer hours, it can be other sources of grant funding. If you are planning on using other federal funds for your match, please let us know before that you submit your application, because that's something that we'll just want to make sure there are some federal funds that can't be used for ESG in terms of match. A few things that are going to look different this year because of the COVID-19 crisis that we find ourselves in. HUD has released some mega waivers that do impact the ESG program, regardless of if you're CV funding or regular funding. Here are a few of the ones that impact ESG specifically. There are more out there, so if you see other mega waiver allowances, just know that those are for other programs. And we have just gotten, like literally right before this webinar, confirmation that HUD has extended the time for that mega waiver to actually cover through the end of the year, back from March of this year. So just to hit on those really quickly, homelessness prevention, that income limit has been raised to 50% of AMI as opposed to 30% of AMI. The requirement to conduct a 3-month evaluations in homelessness prevention is waived as long as you're doing the reevaluations not less than every 6 months. The requirement for fair market rent in the HPRR homeless prevention rapid rehousing component is waived, and rent reasonableness is the standard for the amounts of rent that you can provide for people. And we'll be providing documentation for folks if they're unfamiliar with the rent reasonableness template. And then again, with the HPRR, homeless prevention rapid rehousing, the requirement for monthly case management is waived. You'll see that I said temporarily there. We weren't sure how long that was going to last, but again, that does last through the end of the calendar year. I would not be surprised to see HUD extend that mega waiver, but for now, that's what we know. And again, this applies to all ESG and ESG CV grant agreements. And it looks like we have a few questions. So Kelly and Chelsea, anything that we need to respond to?
Yeah, we have a couple about CV funds. So if all funds cannot be spent down by March 31 for CV1, can they request an extension, or should they plan to have folks apply for CV2 to round out a full programmatic year?
That's a good question. Reach out to us on a case-by-case basis. Our preference is to not do extensions with the CV ones, just because there are different flexibilities with CV1 that we don't have with CV2. And I will dig into that when we get into the CV2 application, but reach out to us on a one-by-one basis for those, and we can dig in and kind of see what's going on. Our initial preference would be to have folks change the ways and the way in which they're spending down the CV1 funds to see if we can get them all spent down by March 30th. But if you are already having concerns about spending down those funds, please let us know sooner rather than later.
Thanks. And then we have a few more. Could you just confirm, can a project focus on preventing, preparing, or responding to coronavirus rather than focusing on all three activities within one project?
Yep, and we will get to all of the CV specific components in about 3 slides. So we're going to dive into all of that. So it's probably confusing and overwhelming right now for folks, but we'll dig into all of that.
Okay, we'll follow up on the other ones in the chat. Thanks, Cassie.
Cool. Okay, so for the regular ESG, just an overview of the eligible activities and the eligible recipients. So street outreach, emergency shelter, homelessness prevention, rapid rehousing, and then HMIS, of course, for our domestic violence providers. That's the comparable database. And then administration. So this is just kind of giving you guys an example of who can use those, who you can serve with those pots of money. Obviously, it's all literal homelessness except for homelessness prevention. And then HMIS can and should be used to collect information on all of your clients. Administration, we used to separate out within the DOH contract. So for folks who are familiar with ESG, who've been doing this for years and years, we used to separate out staff operations, and that's no longer an option. So I just want to clarify just a couple of things. So for the staff who are providing the services, so staff who are doing the outreach, doing the services in shelter, housing people, doing that frontline work, those staff salaries should be allocated to the component for which that staff is providing services. The administration is things like reporting and doing the oversight and supervision of the staff who are frontline. So just wanted to make that clarification. The admin for ESG is limited at 7.5% of the state's total budget for ESG. So there's only so much that we can give out. We know that it's a really hard grant to administer and that we don't have a lot of administration funds that we can pass on. So thank you guys for the work of administering these grants. We are looking at trying to figure out how to help that administrative effort and that burden of admin. So please don't think that our little admin that we can share is a reflection of the amount of work that you do. We know you all are doing a lot of work to administer these programs. And just touching on a few of the eligible activities. Emergency shelter is comprised with 3 primary components: essential services to persons in the emergency shelter, shelter operations being rent, utilities, maintenance costs, those sorts of things. And then shelter renovation, that is an eligible ESG activity, and we do not usually fund it with ESG because we have $2 million to spend across the state for shelter renovations. So if that is something that you are interested in doing, what we have been saying is to come to us as the Division of Housing, because we have many other construction funding sources that you all can utilize to renovate your shelter. There is also some money for renovation in the ESG CV contracts, but if you're thinking of applying this year for the ESG for shelter renovation, just know that that's not something that we've historically done because of the limited amount that we have to administer across the state. And then just one point of note on the difference between emergency shelter and street outreach. A lot of the essential services that you can do for these 2 components is very similar, looks almost identical. Really the biggest piece there is where that person is residing when you're providing them the service. So if they're residing in your emergency shelter, that can be, those funds or those services can be provided under the emergency shelter component. If someone is living out of doors or is a walk-in client, they're not actually staying at your shelter, those should be funded under street outreach. So that's something that we have gotten a lot of questions on lately, so I just wanted to make sure to clarify that. I'm just going to keep going through. We've got a couple of other slides about homelessness, regular ESG and the eligible activities, and then we can get to the questions at the end. I do see that some of them coming through. Okay, so just a quick overview of homelessness prevention and rapid rehousing eligible assistance. So we've got two primary buckets of these funds. So housing relocation and stabilization services is one bucket, and then rental assistance is another bucket. So for the ESG, it's up to 24 months of assistance. Participants have to meet with a case manager once a month. Again, just a note that is waived right now for the coronavirus. And these services can look a lot like the traditional things that help people get into housing, right? Paying security deposits, helping application fees, doing housing navigation, landlord mediation, those sorts of things. Your short and medium-term rental assistance is up to, really up to 24 months of assistance for rapid rehousing or homelessness prevention rental assistance. So the total of assistance through these components cannot exceed 24 months during any 3-year period, including a payment for the last month's rent. So we just wanted to make sure that we're being transparent about that, and that's something that you guys know. And then on the payment of rental arrears, so back rent that folks, that is due, often that is the catalyst for people being evicted and those sorts of things. One payment in up to 6 months of late fees is allowable under ESG. Now, one point I want to make on that, there is some confusion out there right now because of the eviction moratorium with the CDC. And we have been given verbal confirmation by HUD that during the eviction moratorium, no one that has an eviction notice is eligible for prevention. That being said, for folks who are doing prevention, there are other ways in which someone might lose their housing, right? It doesn't just have to be an eviction notice. So if you're going to be doing prevention between now and the end of the calendar year, which is ostensibly when the eviction moratorium will end, the documentation for that has to be something other than an eviction notice. So if you guys have specific questions about that or, technical nuance type things, let us know. This is one of the areas that we're still getting a little further guidance from HUD around, but that is something that is happening right now in the world, so to speak. And then last slide on eligible activities. So this is just going in further into what the housing relocation and stabilization services can be applied to. So rental assistance, rental applications, security deposits, last month's rent, moving costs, utility deposits, those sorts of things that are usually a barrier to keeping people or getting people into housing. One point here, just about the difference between between rapid rehousing and homelessness prevention. The only difference in what those two pots of money can be used for is where a family or an individual were living immediately prior to getting this assistance. So if they were living in housing, their own housing was paid for by them, and they are at risk of losing that housing, it needs to be homelessness prevention. And then if they were literally homeless, if they were living in a shelter or outdoors, then it's rapid rehousing. So those are the differences. But the services and the things that you as the grantee can provide to those households is identical. So just wanted to clarify that. Okay, we're going into CV stuff now. So were there any other regular ESG questions before we jump into the ESG CV2 stuff?
Hey, Cassie, can we just, just before I get into the CV stuff, just quickly renew. So for the regular ESG 20 funds, so those are the ones that agencies can just apply for a renewal of the same funds that they were already awarded, correct? Yep.
So if you have a current ESG contract with us right now, that is not the ESG CV contract. Really what we're going to try and do is use that 2-page renewal application to just extend your existing contract instead of have everybody go through a whole new process of drafting 60 new documents. So normally folks will have to get a new contract every year, but this will just be a 2-year ESG contract. And that's why we are prioritizing the folks who already have those funds for these renewal.
Okay, perfect. And then that one will still be just the emergency shelter street outreach component, correct?
If that's what they were funded for previously,
sorry.
yes.
Yeah.
Yep, no, that's okay, yep. And all of that, and again, always feel free. This is a very different NOFA than we put out. This is a very different process than we've ever done because of the unique circumstances in which we find ourselves. So feel free to reach out to us with those questions. Our contact information is at the end. But if you look at that document and it makes sense now on a Friday afternoon, but it doesn't make sense when you're trying to complete it, just let us know and we're happy to help. Any other questions before we go to CV2? Great, I will take silence as good news. Okay, so friendly reminder that no funds provided from ESG CV may be used to require people experiencing homelessness to receive treatment or perform any other prerequisite activities as a condition for receiving shelter, housing, or other services. That language is pulled directly from the CARES Act. For our Housing First advocates in the room, that's really exciting to see that language codified in the law. But that is something that we have to do with the CV funds. We have to be housing first, and we are not allowed to not treat people because of any prerequisite activities that they don't feel like doing. So if you have questions about that, if you have specific concerns, let me know. This is something that we're going to be monitoring for when we do our ESG CV monitoring visits over the next 2 years, just under 2 years now. So please just be making sure that that is the underlying philosophy of any project funded with ESG CV. Okay, so connection to COVID-19. So this is where we get to that prevent, prepare for, or respond to coronavirus. Any application submitted to us for CV funds has to be specifically and directly connected to a COVID-19 response. That being said, I think it's pretty easy for everyone in the homelessness world to make the case that we are responding to COVID-19 because the best way to prevent, prepare for, and respond to coronavirus in the homeless population is to get them housed. So it should be a pretty straightforward connection. This is the only official guidance that we've gotten from HUD. I do know that we are going to be getting more. I don't know when we'll be getting more, so I apologize in advance. But if there are specific documentation pieces and things like that that HUD is looking for, they will be letting us know over the next few weeks, hopefully not months, but maybe months. So we're just going to go through these really quickly. Prevent corona. I guess before we go into these, the way in which HUD has defined these 3 categories is really how coronavirus has impacted the community in which you're working. So preventing coronavirus looks like any activity that you are doing to prevent the initial infection and spread in your community, right? So if you are an emergency shelter and you do not have COVID in your community and you are moving to a non-congregate sheltering model and you are asking for hotel and motel vouchers so that you can move to a non-congregate sheltering model to keep people from getting and contracting COVID, that would be prevention. Preparing for, so this would look like, let's use that same example, a community shelter. COVID is in your community, and you are trying to make sure that your population is ready to not get coronavirus, right? Either folks in your shelter, maybe a few folks are starting to have it, or you're starting to see an increase. That's what you're, those are like slowing the spread of the disease and avoiding, mass infections and those sorts of things. And then responding to is when there is a COVID spread, and again, not just in the homeless population, but with your staff and the folks who are working with these individuals as well. If you are responding to that outbreak, that's when you're responding to coronavirus. That's all really vague. I understand that. There's a little bit more. There are a few concrete examples in the actual NOFA and in the CV notice itself around what this could look like and some of those activities, what those activities can be. But When you are documenting how you are responding to COVID, just be thinking about what COVID looks like in your community and how the actions that you are taking are contributing to how COVID looks in your community. Most of these projects that are coming and needing ESG funding were serving homeless folks before the outbreak or are serving homeless folks because of the outbreak. So just let us know what the outbreak looks like for you and how that's impacting your service provision. It's got to be documented for all expenses and will be reported quarterly. And we're going to be doing that through HMIS. We're working with HMIS leads to figure out the most convenient way for you all as service providers to just plug in a COVID connection as you're going through your normal daily workflows. We don't want this to be a terribly arduous thing. That being said, again, if HUD comes out and says this has to be terribly arduous, I apologize in advance. We're really going to try and limit that additional burden on you all, which is, again, why we're putting it in HMIS. And we will have a question on our narrative quarterly reporting forms for ESG CV that asks how you've used these funds to prevent, prepare for, or respond to coronavirus. And that's another way in which we can document that. It looks like we had some questions, and so I'm going to stop there and see if there's anything specifically about documentation of connection to COVID.
I think we're okay on questions, Cassie.
Okay, great. Okay, so we're going to dive into the eligible activities for CV funding. We're mostly going to dig into the areas where the eligible activities are different from the eligible activities for non-CV funding, so with the regular ESG. So the first and most stark difference is the fact that we can do temporary emergency shelter with the CV funds. This language is pulled directly from the NOFA, so I'm not going to take the time to read through it, but there are just a few things that I want to make note of. These shelters have to be established specifically in response to COVID. They have to be planned for in a temporary use as of now. And the biggest thing there is that we have to have them be spent down by January 31st of 2022. Ostensibly, from HUD's perspective, these shelters will close, on February 1st of 2022. I realize that's in the middle of winter season, and I think there's going to be a lot of other issues that we all as homeless service providers need to think through as we are getting to the end of that timeline, especially because it's in the middle of winter. But that's the guidance that we have right now. The other thing about these is that it has to be established as necessary by your public health partners. So there's going to need to be some sort of documentation that, we are opening this shelter or changing the shelter or whatever you're doing with this temporary shelter. And our public health official has said that this is what we need to do in order to prevent, prepare for, or respond to coronavirus. There's a couple of examples there of what that can look like. It can be used to fill gaps in local winter shelter. We just did a survey and we're finding that winter shelter beds are down about 30 to 40% across the state in terms of capacity. So folks who do winter shelter, temporary shelter can be something that we use and think about to fill those beds because, again, ostensibly, when this is over, we won't have that gap of winter shelter. Another thing that's very important to think about, and we will get into this on the next slide a little bit, but under temporary shelter, there are some flexibilities and additional services that you can provide that you can't really provide from the emergency shelter component. So that includes the housing, stability, and relocation services that we just covered a few slides back in the prevention rapid rehousing component for regular ESG. And it also includes housing counseling and search as is defined in the COC regulations. So those are a few new components. The reason that those components are included in temporary emergency shelter is because there should be a plan to house all of the folks who are in temporary shelter when that closes. It's a very broad statement. The language in the CV notice is quite broad as well. But we do want people who are doing temporary emergency shelter to be doing a parallel housing plan along with that, so that we're not just, spending all of this money to shelter people and then come February 1st of 2022, they're back where they were. It's a lot easier said than done, and we know that. And so for folks who are going to be doing temporary shelter, we're going to be looking to partner with you or connect you to the resources that you need to get that to happen. So just a few other pieces of the temporary shelter. So it's the same types of services that is in the regular ESG shelter. So shelter operations, essential services, again, housing search and placement, housing counseling, and we can do leasing, acquisition, and renovation of temporary shelter. That being said, please, if you hear nothing else from this webinar, hear this. For folks who are interested in acquiring temporary shelter through the NOFA, through our NOFA, we have gotten guidance as of yesterday, I believe, that HUD, the two options for combining, or I guess for answering the question of how can we be doing temporary shelter if we're acquiring real property and we have this purchase? HUD has given us guidance that if we acquire space, if we acquire buildings with temporary emergency shelter, we will either, we being you all as the recipients, will either have to sell the property after its use, so ostensibly in February of 2022, and return that money to HUD, or not sell the property and just pay back HUD. We have not gotten any guidance other than that in terms of how temporary shelter and the ability to do acquisition, which is a very non-temporary action, how those two pieces live together. So until we get further guidance, we are not going to be doing shelter acquisition unless you all as a grantee can show us what your plan is to pay back HUD. That's unfortunately not something that we can be flexible about, and it's not really something that I can provide more concrete answers on as of yet because we haven't gotten concrete guidance from HUD. But those are the two options that we are hearing right now. One, either pay back HUD, so this would be more like a loan rather than a grant, or two, sell the property and return the funds from that sale back to the federal government. So just want to get that out into the air. That's what we're hearing. Don't have guidance yet. You all will know as soon as we know. There are a few other key differences from temporary shelter and regular ESG emergency shelter. So there are less habitability and environmental requirements. So you don't have to go through the whole rigmarole of doing the habitability and environmental inspections and those sorts of things. That can be a time barrier for establishing a lot of these shelters. And so that's primarily why HUD has removed it, because of the time it takes to do those things. Obviously, there's no minimum period of use because these establishments are supposed to be temporary. Funds, again, have to be spent by January 31st of 2022. That's for emergency shelter through the CV funds as well, not just the temporary shelter. The recipient must maintain documentation until January 31st of 2022 of the temporary nature of this use. So HUD is expecting to see you all documenting that this is only temporary. Again, don't know 100% what that looks like yet. They're still figuring it out amongst themselves. They're trying to figure out how we can transition temporary shelters into permanent shelters, but until that is released, only the temporary shelter is eligible, and it cannot be something that is planned for in the long term. And then just a couple of things that you can do. So you can provide space for folks to receive services, even if it's not ESG funded services or part of the specific shelter project that you're working on. Again, folks cannot be required to sign leases or occupancy agreements or behavioral contracts or to have to receive treatment or to perform any other sort of prerequisite activity as a condition for being in the shelter. But besides those things, which are pretty huge changes, the funding and operation of temporary emergency shelter is going to look exactly like the normal emergency shelter under 24 CFR Part 576. That regulation is built into our NOFA as well as the budget, but if you do have specific questions about what that looks like and what that means, just reach out and let us know. Any questions in the chat about temporary emergency shelter?
Yeah, Cassie. Oops, sorry.
Yeah.
One question would be, so for the temporary emergency shelter piece, would partnering with a hotel to pay for hotel motel stays be applicable under this eligible cost?
Yeah, so you can do hotel motel vouchers. That's part of the shelter operations component. It would be kind of similar to paying lease, right? And again, that would just have to be something that's specifically related to COVID and is intended to be temporary.
And then just to reiterate, Hannah, to your question, so if I'm wanting to start a shelter, it would be more of a loan, not a grant. Yeah, so like Cassie said, that would be one way to look at it, is more similar to a loan. Again, we've only gotten this information verbally from HUD, and so nothing is formal or in writing for us, but that would be one way to view it.
And just one thought on that too, that's just for the acquisition of temporary shelters. So unfortunately, we cannot do acquisition with the normal emergency shelter line, but if you want to start an ongoing shelter that you're hoping is not temporary, you can apply under the regular emergency shelter line. Those funds, again, do have the limit of being spent down by January 31st of 2022 for ESG CV, but our regular ESG funds will continue the funding for the regular shelters that are operating. And that's something that, knock on wood, as long as HUD exists, we'll have year over year based on the formula grant funding that we get from them. Other questions about temporary shelter? Okay. So emergency shelter and street outreach, those activities in terms of eligible uses of funding look almost identical to the regular ESG. There are two additional things that I wanted to make note of. So one, we can pay for volunteer incentives. So we know a lot of you are really great, scrappy nonprofits with shoestring budgets doing really hard work. And you rely on volunteers a lot of times to have that work be done. We know that COVID has made volunteer recruitment a bit challenging, to say the least. So we can do volunteer incentives with ESG funds. So if there are things that you guys are needing to get folks comfortable being in your shelter, please ask us for them. That can look like cash or gift cards for folks who are doing the work. That can look like buying PPE, protective personal equipment. That can look like all sorts of things. And that should be for folks who are working on the front lines with the folks, really anybody volunteering for your agency to help provide the services that you are providing under emergency shelter and street outreach. Again, the volunteers would have to be performing ESG eligible activities in order for them to receive these incentives from ESG CV. We can also do hazard pay. So for people who are directly at risk of getting COVID because of their work, a lot of agencies have started offering hazard pay as a way in which to get people to keep doing that work. And again, that is something that can be done with emergency shelter or with ESG CV. So let's say the way that you all are going to apply for these two additional activities is as you're applying for, let's say you're applying for street outreach, you are a rural agency and your entire street outreach team is volunteer driven, except for one full-time person, right? So part of your ask in the budget will be for a volunteer incentive. And then part of your ask would be for hazard pay, if that's something that you would want to provide for your full-time employee. So you'll just see those as eligible activities underneath the larger component of emergency shelter or street outreach. And just note in the budget, it's a Excel spreadsheet form. There's a little drop down that should have all of the eligible activities listed there. Just note what you're expecting to spend on volunteer incentives. One note on the budget, if you say, for example, we're going to spend $1,000 on shelter operations, $1,000 on volunteer incentives, and $1,000 on hazard pay for our emergency shelter. And we grant you that full $3,000. You don't have to stay specific to those actual line items. We'll just want you to have spent $3,000 on your emergency shelter. We realize that these things change, especially with the hectic world of a pandemic. So do know that even though the budget is incredibly detailed, we're not going to be expecting you guys to stick to that budget line by line. It's component by component. So however much you're funded for emergency shelter or street outreach, that is the amount that you will have to stick to. One thing that I did want to make note of here, so we've been having a lot of folks asking about safe outdoor space or safe parking and those sorts of things. Going back to the slide about eligible services and how we can help support that effort with ESG. If you are in a typical traditional emergency shelter and you're providing services to people, you would apply for essential services under emergency shelter. If you are in a outdoor space or if you're running up a safe parking space or something like that, where folks are in the HUD lingo is non-facility based. That's not a real word, but I think it's a good explanation of the difference between the two components. So if you are looking to do safe outdoor space or emergency or safe parking, while we can't pay for things like infrastructure or things like that, we can help pay for the staff who are providing those services, and that would be eligible under street outreach. There are some specific call outs of eligible activities under street outreach. So for folks who are interested in doing that, things like hygiene, things like giving people access to washing their hands and going to the bathroom, and some of those things that help really make sure that, especially for most vulnerable who are living out of doors, they need access to that hygiene. Those are eligible activities under the street outreach component as well. And it looks like we had a few questions come in, so I will stop there if there are any questions about this specifically. Okay, I will take silence as nothing, but let me know if I'm missing something.
Hey,
Okay.
Cassie. Hey, actually,
go ahead.
could you respond? Has definition of COVID response through ESG moving beyond just those at risk FEMA, but also to decompress shelter in general? And Kelly, I know you might want to jump in on this question too. I don't know that I'm understanding the question fully.
So my understanding, and for whoever wrote the question, please let me know if I'm interpreting this incorrectly. So if folks are impacted, like if you have an outbreak in your shelter and you're doing something about that, that would be responding to coronavirus. But if you are a shelter provider and you are trying to keep people from getting COVID and you haven't had an outbreak yet, but you're decompressing that density, providing social distance protocols, putting people into hotels, those sorts of things, yes, absolutely. Those funds that would be preventing coronavirus. And that is an eligible activity. Does that answer the question?
Yes, that was perfect.
Okay, great. Okay, so one big difference from our ESG application to our ESG CV application is that we are not funding prevention with our ESG CV application. There are a few reasons for that. One, I mentioned that we have the Next Step program that has the large chunk of what we are allowed to spend from CV2 on prevention. Two, the eviction moratoria in place really limits what can be done with prevention. And three, we have many, many other state-funded pots of funding right now for prevention that are at least through the end of the calendar year, if not continuing after that. So you might see prevention as an eligible activity in the next CV2 NOFA that we put out. But for this one, we are not funding prevention. And if you do need or want prevention, please do feel free to let us know outside of the NOFA process, and we can connect you to those other funding pots for prevention. There's actually quite a lot of money out there at the state level right now to prevent folks from experiencing homelessness. So we're prioritizing our ESG CV for rapid rehousing, which means that folks who are literally homeless right now who need to get into housing. That's the population we're prioritizing with, at least again with this first NOFA. There are a few really important things to notice if you want to apply for rapid rehousing. The first, and this is very unfortunate, and I apologize in advance, and there's absolutely nothing we can do about it, but HUD has limited the number of months of assistance that we can offer for rapid rehousing for rental assistance. So we can only do up to 12 months of rental assistance for rapid rehousing. That does not limit the number of months that they can get case management. That does not limit the number of months that you can provide housing stability support and those sorts of things. But in terms of rental assistance, anything for CV2 has to be limited to 12 months. Here's the other kicker. If you were a recipient of CV1, you have 24 months for rapid rehousing. So for our COC partners out there, and for folks who are receiving the CV funds from the COC partners, the funds that you already have can be used for 24 months of rental assistance. The funds for which we are applying now can only be used for 12 months. I know that's very confusing. It's going to be very hard to track. We are still figuring that out. We might be tracking it in HMIS. We might be tracking it outside of HMIS. We aren't sure yet. But that's not something that we have the flexibility, unfortunately, to do anything about. So if you are going to apply for rapid rehousing and have questions about that, again, please reach out. It will be much easier to set up these programs correctly rather than try and fix them if something goes wrong. Another difference is that we're not limiting the rapid rehousing application to COC applicants with CV funding. So if any shelter provider, any outreach provider can apply for rapid rehousing, but it must utilize the coordinated entry system as dictated by the COC. So even though it doesn't have to flow through the COCs, you still have to be working in partnership with the COC in order for you to get those funds. An additional activity that rapid rehousing can pay for is landlord incentives. So there are some specific examples there. Signing bonuses of up to 2 months, security deposits of up to 3 months, paying for repairs and damages, and then paying for extra costs of cleaning. Those are things that you can apply for through rapid rehousing, and you can also do hazard pay, which we've already touched on. But those two will show up in the budget in the same way that the other eligible activities under rapid rehousing will show up. So if these are things that you do want to apply for, please make sure to note that in the budget. There will be some specific tracking mechanisms, primarily for the landlord incentives, that we will want you to be aware of. Questions coming through about that?
Yeah. So first, to answer someone asked a question about the difference between CV1 and CV2, and just want to reiterate what Cassie said about for rapid rehousing, CV2 being 12 months and CV1 being 24 months. And then Cassie, the questions are, if the COC would like to do a joint application, is that allowed? So if we have 4 partners that would like the support of the COC to do rapid rehousing, can the collaborative applicant apply on their behalf?
Yeah, and we provided this flexibility just to alleviate any additional admin burden on our really wonderful COC partners who are strapped right now, just like everyone else. I would just say if there are collaborations or mutual partners who are coming in one application, we would just want to see some sort of letter of like support or letter of approval of the application or whatever from all of the partners involved. For that specific example, feel free to reach out directly and I can give like a more specific and in writing answer in terms of what that looks like. But if folks want to come together to apply, absolutely.
Great. And then another question, if we have not expended all of CV1 but anticipate a shelter expense next spring, such as professional sanitation, can we apply for CV2?
Yeah, so what we are going to look at for the folks who got CV1, you know, I mean, you guys still don't have your contracts yet. Like we realize how challenging that is. Because of the additional flexibilities that our CV1 funds have, it's only about $7 million for CV1 compared to about the $25 million that's for CV2. We're going to take a look at how many people were able to spend down the funds and how many people weren't. So we might not do shelter, or we might not do contract extensions. So for folks who do have CV1 who might not be able to spend it down, go ahead and apply for CV2, and we can look at that on a case-by-case basis based on how much money is left over in those contracts and what makes the most sense from an administrative perspective.
Okay, and Jacqueline will answer your question in the chat.
Awesome, thanks guys. Okay. The other eligible cost, and it's a standalone component, it's not under any of the other components, but training is something that HUD has specifically pulled out and has made eligible for the CV funds. So obviously this is going to be, you know, training for prevention, infection prevention, mitigating the disease amongst homeless assistance providers. The training does have to be related, again, specifically to COVID, but to help help ensure that our recipients can prevent, prepare for, and respond to coronavirus. So that is pretty much the only written guidance we've seen around training. I fully expect there to be some more about that. If you do have questions about training, thoughts, ideas, can we do this, can we do that, let us know. We do have quite a bit of HUD TA right now that we as a state have access to, and so we have should have a pretty quick response mechanism to get your questions answered. So if you have specific questions about this, let me know. And it looks like we had a few questions come into the chat. Anything we want to touch on before we go on to documentation reporting and other things for both funding sources?
I think we're good. Thanks everyone though for all of your questions. We appreciate them.
And yes, thank you, Kelly and Chelsea, for managing that chat. I appreciate it. Okay, so we've got about 25 minutes left. I'm gonna go through these slides pretty quickly. There shouldn't be too much new here, but these are pieces that apply to both ESG and ESG CV. So whichever one you're applying for, this should be appropriate to you. So administration costs, here are just some examples of the administration costs. We do have a limit, so it's 7.5% for ESG and 10% for ESG CV. So we are trying to provide more admin for folks. We know that these are really hard programs to oversee. We do have more admin with CV2 than we normally have for an entire ESG program year, which is exciting. And we are trying to pass that on as much as possible to our partners. So you'll see there are specifics of what you can and cannot apply for in the application itself. So just please don't ask for more than what the application says you can apply for, but do ask for admin if that's something that you need. Okay, so just really quickly on HMIS, Homeless Management Information Systems, it is a requirement to use HMIS anytime you're using ESG funding. So if you get funded, even if you get funded, let's say you're funded in December and you want to be using pre-agreement costs back through October, you have to be using HMIS back through October. Most folks on the call, I'm going to assume, are already using HMIS because you either already have ESG or some other HUD-funded resource. If you don't, reach out to your HMIS lead sooner rather than later and start talking with them about what it would take to get you into the system. They're wonderful people and they do a great job. Here are just the examples of what you can pay for. So really concretely, the equipment and the hardware and the software that it takes to be in HMIS, as well as the staff time actually doing HMIS reporting and those sorts of things. You can use HMIS for, you can use HMIS funds for training and, you know, the overhead of managing the people who are in HMIS. You can do, you know, obviously, like if you are applying to us, you're using HMIS and you have other programs, it's going to be really hard to kind of cut up your program to only have like ESG specific HMIS costs. So HMIS is allowed to be a little bit more flexible in terms of what it can be used for and what it means for just like agency-wide use of that system. So if there are specific questions about HMIS, reach out to us or your HMIS leads, and we should be able to get that answered. If you are a victim service provider, legally you can't use HMIS, but you can apply to us for those same sorts of costs for the comparable database. We are actively in the process right now of establishing the CAFE system as a comparable database for HMIS. Hoping that that system will be up and running by the end of this year. Don't quote me on that. I'm recording a webinar and probably shouldn't have said that, but just so that you guys know, that's the goal. We're working with CDHS, Department of Human Services, who fund CAFE. All of our DV providers are already using CAFE. If you are receiving money from us and you're a DV provider and you're not using CAFE, please let me know as soon as possible and we will figure out what that means. But CAFE should be a free system for you. It should be a system that you're already used to. And once we get it established and get it built out as a comparable database, you all will be able to just click a button that says pull a CAPER or pull an APR if you have COC funding. And the system should do that and zip it for you. And hopefully it'll be a very easy process. Still working through some of those details, so don't shoot the messenger if that's not exactly how it works out. Questions about admin or HMIS or the comparable database?
Yeah, Cassie, oops, sorry.
Oh, Kelly, go ahead.
Sorry, Cassie, could you just repeat, just review the admin percentages again?
Mm-hmm. Yeah, well, so it's the full percent of the grant that we can use as admin is 7.5% for ESG and up to 10% for ESG CV. That does have to be distributed across many partners. We are paying for, like, for example, building out CAFE as a comparable database. We're paying for that with the admin line item, so we might not be able to pass on that full amount, but that is the maximum amount across the grant that we can use for admin.
And then if a COC collaborates on an application, do all partners need to be a 501c3?
Oh, that's a really good question. So if any of the ESG money will be given to those entities, it has to be one of the eligible types of applicants. So either a 501c3 or a local government. If there is a specific agency that doesn't have their 501c3 status or is a private agency or something like that, reach out and we will work through that on a case-by-case basis. But my gut is telling me that yes, it has to be either a 501c3 or a unit of local government. Anything else?
One question just came in. Just to clarify, can equipment such as computer for data entry be spent from a CV grant?
Yes, as long as you can make the connection as to why that computer is part of your COVID response, which is, you're getting these funds to prevent and prepare for and respond to coronavirus, and part of what we are asking you to do is to enter into HMIS, and so you need some additional capacity to do that. Then that's kind of just an example of how that connection could be made.
Great. And then is a housing authority local government?
So that's a really great question. We actually are able to partner and fund housing authorities directly with CV. That is not something that we're able to do with regular ESG, but for CV, yes, that would be considered a unit of local government. I don't know if it would be considered a unit of local government, but it is considered an eligible applicant.
That's it.
Anything else? Okay, great. All right, so just some fun government slides. we just some things that we need across the board in terms of documentation, written procedures, some of that fun stuff. Just a reminder, if you have ESG or ESG CV, you have to develop and use local policies and procedures for record keeping. If you're part of the COC, you probably already have these policies and procedures, but if you are a recipient from us, make sure that you have ESG policies and procedures. We are actually in the process of completely renovating our policies and procedures, and we'll be sending that out to you all soon, so feel free to use that as an example. It's going to be a dense document, but that you can absolutely use that as the foundation for your policies and procedures, or you can make it a lot more simple than that. And these are just some of the things that, examples of what must be included in your policies and procedures. So, maintaining records, establishing protocols for backup documentation, systematic approach for screening potential applicants, all of that really fun government stuff. If you have questions about your policies and procedures, there are a few upcoming webinars that will be very helpful for you, but always feel free to reach out and ask us. We were happy to help you work through those. Kelly and Chelsea have been digging into our policies and procedures and really are loving doing that kind of work. So let us know what questions you have. A couple of other points that we want to make sure you all are aware of. Documenting homelessness is absolutely something that we have to do for ESG. Of course, if you're doing prevention with the regular ESG funds, that's at risk of the risk of homelessness that people are seeing. So the documentation has to be specific to the individual or family. The explicit criteria that's establishing the eligibility, and it has to be relevant in terms of time, right? So if somebody was homeless 3 years ago and they're not homeless now, but you want to give them rapid rehousing, that documentation is not viable because they're not homeless. It has to be relevant in terms of where they are. So what HUD would prefer in terms of the source of that documentation, best case scenario for HUD, a third party documentation, which can be written or oral. Intake observations, so you guys can see when someone comes to you. A lot of times if someone is experiencing homelessness, especially if you're street outreach or emergency shelter workers, you all can make that verification. And then the third would be self-certification, someone telling you that they are homeless. We have examples of all of this documentation if that's something that would be helpful for you. And these sources of documentation just need to stay in the case files. You don't need to send it to us or have us review it or anything like that. But when we do monitoring, we'll pull a few of those files, and these are some of the documentation pieces that we'll want to make sure you have in those files. So obviously there are going to be exceptions. Not every person is going to have a third-party verification of homelessness. So it should not, the lack of that third-party documentation should not prevent immediate access to these life-saving services, right? Like if somebody can't provide you a written documentation of their homelessness, that doesn't mean they don't get access to your shelter. That doesn't mean they don't get access to any of that emergency response. And then, of course, just with the DV provider, that third-party verification should only be obtained if that does not jeopardize the safety of that individual or family. And then again, just to talk about the ESG reporting systems, this is something that is going to be a change for anyone receiving ESG. So even if you've had ESG for 20 years, this is going to be something that's different for you. HMIS is HMIS. Neighborly. Neighborly is DOH's new grants management database. Basically, it's just a platform for keeping all of the information that we are doing manually and via email right now. We are, as we speak, building out Neighborly and getting it established, but any pay requests for CV funding and all future pay requests after this most recent one that is due October 20th for the regular ESG funds will come through Neighborly. Same for quarterly reports, that will all come through Neighborly. It is going to be a switch. So for folks who are not great at computer systems or using new systems, we have lots of resources for you. We have lots of webinars coming up that are going to help provide you all understanding on how to use that system. But it should make things a lot easier. You will be able to log on to Neighborly and see your real-time budget. You'll see where, if you sent us a pay request a month ago and you haven't seen your reimbursement yet, you can log into Neighborly and see who's holding it up and see how long it took us to review it. You'll be able to go in and look at your quarterly reports and those sorts of things. All your key documents will be in one spot. And next year, so in 2021, when we do our ESG regular year application process, that will go through Neighborly as well. So no more paper forms, no more wonky budgets. That will all go through Neighborly. It's a very user-friendly system, at least we think it is. We hope that you guys think it is too. And we have a few upcoming resources that we will show you about how to use Neighborly. But again, Kelly and Chelsea and Galen as well are great resources, and we'll be there to help you work through that system as we do that learning curve. And then again, CAFE, the system that we are creating as an HMIS comparable database for our ESG and COC funded agencies. Again, if you are a victim service provider, you are wanting ESG or you have ESG and you are not currently using CAFE, please let me know sooner rather than later. And then just a quick reminder of some other record keeping and monitoring pieces. These are all things that we're going to want to see in each client file. Hopefully you all are already doing these things, but just a quick list of what that looks like. So documentation of homelessness, the income if you're doing rental assistance programs, fair market rent and rent reasonableness. Again, fair market rent does not apply at least until the end of this calendar year. I'm thinking HUD will probably continue that waiver, but we will see. Lease and rental agreements, confidentiality policies, grievances. So if there are grievances or people complain, those sorts of things. Types of assistance provided, your habitability standards. So for shelters, habitability standards are done once a year or once for the term of the contract. And should apply throughout the term of the contract. So you can't just say that you're doing something and then stop doing it halfway through the contract if you're a shelter provider. And then for rental assistance providers, that would be habitability form for each of the units that you are moving someone into. It's a pretty straightforward form, but that is something that we need to see. Termination documentation. So if somebody is removed for a program, why were they removed and what did that look like? And then recertification, if that's applicable. Again, that's for primarily the HPRR funding sources. And I will send out these slides, but if you want this list, we have a couple of upcoming webinars that we're going to talk about on the next slide. But before we get to that, are there any questions in the chat?
Yeah, Cassie, so I do have one. The question is, can we include federally approved indirect costs as part of other line items rather than as admin for these grants?
Ostensibly, you know what? I'm not going to give an answer on that one. If that person would shoot me an email directly and just let me know what the federally approved costs are, I don't think so. I think if you're doing anything indirect, it has to be done through admin, but I can triple check that if they could provide some more detail around what those costs are.
Okay, perfect. And then one more question that just came in. So it says that NOFA says that ESG CV2 funds can be used to renovate buildings to be used as emergency shelter. Can these funds be used for renovating buildings that are currently emergency shelters? And can we ask for capital expenses?
Yes, they can be used for renovating buildings that are current emergency shelters. Just one comment on that I would just be really transparent about with people. For our CV2 funds, we had $7 million to allocate, and we had $19 million in ask. So if this is the only funding source that you are looking at for that renovation, I would just caution of putting all of your eggs in that basket. If we do have renovation funds that come in, you know, obviously you guys all know the state is in a huge budget deficit right now. So we will try and connect you to funding sources that could be used for that. But I do think that we are going to use some of the ESG funds for renovations. Just know we're likely not going to be able to be the only funding source for that renovation. In terms of capital costs, if that's a reference to capital construction, unfortunately not. We are not allowed to do construction of any kind with ESG. That includes ESG CV. We can, again, do the acquisition if you're doing temporary shelter, but then you run into either having to pay back HUD or sell that building. And until we get further guidance, that's all we know, so that's all that we're going to be able to do. So yes to the first part, no to the second part, if the question was asking about construction costs. Anything else?
Nope, that's it. Thanks, Cassie.
Great. Of course. Okay, so a couple of upcoming training webinars. I should have sent everyone an email, I think it was last week, but my time is wibbly wobbly lately, so it might not have been last week. If you didn't get the email from me, send me an email. We're creating an ESG specific listserv, so if you want to be on that, let me know. If you did get that email, you're already on it, so you're good to go. The first training is going to be next Tuesday. This is going to be required for all grantees because this is our Neighborly Grants Management Database training. It will be recorded and it will be something that you can go back to time and time again. Neighborly also has a lot of really great pre-recorded videos that you can pull up anytime. That's not just specifically this training, but just general, how do you use these things? So again, just to reiterate, all pay requests and reports for ESG and ESG CV will be coming through the system very, very soon, if not by the time your contracts are executed. Again, eventually they will collect all of the ESG applications as well. Hopefully this will make your lives easier. I truly apologize if it doesn't. Let me know if it doesn't, and we can figure out how we can use it as a tool to make your life easier. The training for this one is going to be Tuesday, October 6th from 12:30 to 1:30. Again, if you did not get my email, please let me know because that had the link for the training. I have sent it out to a lot of folks, but if you didn't get it, let us know. Kelly and Chelsea, if folks are saying in the chat that they didn't get it, if you wouldn't mind just dropping that link, it should be in the calendar invitation that you guys have on your calendars. Another training that's happening on Tuesday, October 6th, this one's from 10 to 11, is best practices in street outreach. And this is in partnership with Built for Zero. So if you all are familiar with Community Solutions and their Built for Zero initiative, they are working pretty intensely with a few targeted Colorado communities, but they're also working across the state to help us improve data collection and have street outreach as part of that. Really looking at how to increase street outreach fidelity in a way that it connects to coordinated entry systems and provides better data for us as a state as to who is literally homeless and living outdoors. We are putting together an ESG 101 webinar. So some of these slides, specifically in terms of documentation or expectations, reporting requirements, those sorts of things, if those slides were new information for you, or if you are new to ESG, or if you have been doing ESG for 20 years and you're rocking and rolling and you just want a quick refresher, I would highly suggest that you all watch this webinar. It's not going to be a live webinar. We're just going to do a recording. It's going to be quite dense, so we're not going to have time for questions and things like that. We don't want it to be too long, but we're putting it together with HUD TA and with our policies and procedures update. So it should also really help just codify exactly what we're looking for in our ESG programs. And then to be determined, at some point after October 9th, we are also doing a Winter Shelter 101 webinar. So this will be just some best practices. HUD is working on creating some products to help folks who are trying to plan for winter shelter year over year, to help give you all some tools to hopefully make that process a little bit easier. Working on winter shelter can be really challenging for a myriad of reasons. And so one of the efforts we want to focus on is making sure that that infrastructure across the state is really built up. Those two recorded, or the ESG 101 will be, I guess, actually all of these webinars will be recorded and put on the DOH ESG page, so you can go back and access them at any point. That is also where this webinar will be held and recorded. And we are going to try and do more intentional training webinars to help We don't want to do webinars if you all aren't finding them helpful, but if there are training things that you have questions about, you know, things that you could really use some technical assistance around, please let us know. Give us suggestions. We are very much open to that. Part of our updated monitoring policies will actually include hearing from you all as grantees of what we can be doing better, what questions you have, and we'll be creating tools specifically in response to those things. So with that, questions, comments, concerns, that is my personal email as well as my personal cell. So if you have any questions or are submitting applications, please send anything and everything to me, and we can get it answered. It looks like there are a few questions coming in. So Kelly and Chelsea, I will defer to you all. What do folks have questions about?
I don't see any. Kelly, do you see any questions? Or if anyone in the chat, if we missed your question, please let us know. There is one that I know we need to follow up on. Someone asked about who received ESG funds. So we'll send that out as well. We can send a list to the person who asked that. I assume we have a list, Cassie.
Yes, we do. Okay. Well, we have a whole extra 2 minutes. I was hoping to give you guys a little more than 2 minutes back into your day, but thank you for sticking with us through that whole webinar. Like I said, this will be recorded. This will be posted onto DOH's website. Again, here, that is my contact information. So please feel free to reach out if you do have any questions. Otherwise, we look forward to hearing seeing your letters of intent on October 8th and your full applications on October 23rd. I will stay on the line for just a few more minutes. Kelly and Chelsea, if you guys don't mind hanging on as well. So if folks do have specific questions and want to ask us directly, just feel free to stay on and do that. Otherwise, I am going to stop sharing and stop recording. And thank you all for the work that you do every day of helping folks experiencing homelessness. We would not be here without you guys. So with that, have a great rest of your day.